The 7,260th meeting of the Security Council is called to order. The provisional agenda for this meeting is the situation in Liberia. The agenda is adopted. In accordance with Rule 37 of the Council's Provisional Rules of Procedure, I invite the representative of Liberia to participate in this meeting. It is so decided. On behalf of the Council, I welcome His Excellency, Mr. Brownie J. Samukai, Minister of National Defense of Liberia. In accordance with Rule 39 of the Council's Provisional Rules of Procedure, I invite Ms. Karin Landgren, Special Representative of the Secretary General and Head of the United Nations Mission in Liberia, to participate in this meeting. It is so decided. In accordance with Rule 39 of the Council's Provisional Rules of Procedure, I invite His Excellency, Mr. Martin Grunditz, Chair of the Liberia Configuration of the Peacebuilding Commission and permanent representative of Sweden, to participate in this meeting. It is so decided. The Security Council will now begin its consideration of Item 2 of the agenda. I wish to draw the attention of Council members to document S 2014-598, the 28th Progress Report of the Secretary General of the United Nations Mission in Liberia. I also wish to draw the attention of Council members to document S 2014-644, a letter dated the 28th of August 2014 from the Secretary General addressed to the President of the Security Council. I now give the floor to Ms. Karin Landgren.
Thank you. Madam President, the report of the Secretary General on Liberia that is before you has been overtaken by the Ebola virus disease epidemic. Liberians are facing their gravest threat since the war, and my remarks will focus on this. The spread of EVD in Liberia has been merciless. The Ministry of Health puts the number of reported cases above 2,070, with over 1,200 deaths. But these numbers understate Ebola's true toll. The speed and scale of the loss of lives and the economic, social, political, and security reverberations of the crisis are affecting Liberia profoundly. Unlike an earthquake or a flood, this crisis grows exponentially, with every fresh infection begetting others. Caring for the sick and burying the dead are traditions now freighted with risk. The Liberian health system was the region's weakest, despite a decade of partnership efforts. Now, at least 160 health workers have contracted the disease and 80 have died. Most health workers have gone long stretches without proper protective equipment, training, or pay. Local funeral rites, which involve touching and washing of the dead, have led to countless new deaths and will need to be replaced with safer rituals requiring the commitment of religious and traditional leaders. Many communities denied that Ebola existed at all. There's no real disagreement among health experts about what needs to be done. Advocacy and community mobilization, prompt removal of suspected EVD cases from communities to case management centers, urgent and safe disposal of bodies, and robust contact tracing and active case search are the main elements. This does require going community to community and even door to door to inquire, inform, and support. It requires health workers to staff Ebola case management centers while employing meticulous infection control measures. For now, patients at advanced stages of EVD continue to be brought to facilities that cannot admit them. 4 new case management centers will be established in Monrovia, adding some 500 beds in the capital alone, but even this may not fully respond to the needs. We will know this epidemic is being outrun when we find there is spare bed capacity. Madam President, by late July, the EVD outbreak had triggered widespread alarm, and the government took several measures. Borders were closed other than a few strictly controlled crossing points. Non-essential government workers were sent on mandatory leave, and most government travel was restricted. Border markets, schools, and other institutions were ordered to close, and large gatherings were suspended. But Ebola's spread outpaced the government's ability to respond. In several instances, public anger broke out over the failure to remove bodies of EVD victims from streets and houses. On August 6th, President Ellen Johnson Sirleaf declared a 90-day state of emergency, stating that the scale and scope of the epidemic exceeded the response capacity of national institutions and existing legal frameworks. Extraordinary measures were required, the President said, including the suspension of some constitutionally guaranteed rights. The legislature endorsed the decision as required by the Constitution. Later in the month, a curfew was instituted from 9 p.m. to 6 a.m., since yesterday pushed back to 11 p.m. Within the context of this state of emergency, the narrow domestic role of the armed forces of Liberia was broadened and the army deployed, along with the National Police and the Immigration Service, to isolate highly EVD-affected counties and communities and to protect the less affected counties. The benefits of isolating Ebola-affected communities to prevent disease transmission are not clear. These operations to date have not always included prior arrangements to make available food and water, nor sufficient supportive engagement with the communities concerned. On August 20th, when the government mounted an AFL-led operation to isolate the West Point area of Monrovia, prices of essential goods within the cordon skyrocketed within hours. Panicked residents protested the cordon, and in the confrontation with the AFL, shots were fired and a 15-year-old boy was fatally wounded. Following this incident, President Ellen Johnson Sirleaf made the commitment that there would be no further use of lethal force, and on August 30th, the West Point cordon was lifted. Movement restrictions throughout the country continue, including through operations of the armed forces. Criteria for passage at checkpoints has not been consistently implemented or clearly communicated to the public, and opportunities for vigilantism and profiteering have increased. Although some coordination has been visible among security agencies in the EVD response, each agency has planned and executed its own security operation, with coordination more visible at county level. A joint command center has been established to oversee nationwide operations. Madam President, the halting of cross-border trade, domestic movement restrictions, and general economic uncertainty have prompted panic buying of food and other goods. Several major concessions have reassured the government and their employees that they are not planning to close, although many have reduced operations and repatriated foreign personnel. A number of forestry concessions have stopped operating, and over 10,000 forestry workers have reportedly been laid off. With unemployment and underemployment already high, Ebola has added to Liberia's economic uncertainty. The Ministry of Finance and Development Planning has announced that the government already faces a $57 million revenue shortfall and informed donors of preliminary indications of a $116 million budget gap. Growth projections have been revised downward to 2.9% from 5.9%. The executive is revising the budget to reflect revenue shortfalls and to assure that the government has the resources to operate while responding to Ebola. The national budget for the fiscal year beginning 1 July not having been passed, the government has been operating on an advance equivalent to 1/12 of last year's budget. The EVD outbreak has also created uncertainty around some fundamental democratic processes. Noting that it would be unable to deliver credible senatorial elections in October, as scheduled, the National Elections Commission proposed a postponement until the second week of December, which would allow the vote to take place before the 15 incumbent senators finish their terms on January 6th. The legal framework for a postponement is being explored by the legislature and the Law Reform Commission. The NEC will need clarity soon. There is growing recognition that even a December electoral timeline may be difficult to maintain should the crisis stretch. The constitutional review process has also suffered. The National Constitutional Conference envisaged for August could not be held, delaying national discussion on proposed amendments and the legislative consideration of proposals that was to follow. It pushes the national referendum on constitutional reforms into at least 2016. Madam President, the government is, by its own admission, extremely stretched. Several officials have reportedly left the country or remain abroad, despite the President's office announcing on August 11th that officials who failed to return to the country within a week would lose their jobs. A lack of confidence in the government's capacity to address the crisis has contributed to fluid political dynamics, and it has been widely reported that some Liberians, including among the diaspora, have called for an organized transition from the present government. Successful Ebola response will require steady governance. Since the end of the Civil War, Liberia has made progress in developing basic institutional capacities while laying the foundations for a transformed democratic state. However, the Ebola crisis has started to strip away some of this progress. The enormous task of addressing Ebola has revealed persistent and profound institutional weaknesses, including in the security sector. As demands pile on, the police face monumental challenges in planning and implementing large-scale operations due to poor logistics and communication, an overly centralized command structure, and over-concentration of personnel in Monrovia. Although the delicate progress achieved in the security transition may be stalled by Ebola, the handover of security functions from UNMIL to national actors has so far taken place according to government and UNMIL agreed timelines. Since the completion of Phase 2 of UNMIL's military drawdown in June, the mission no longer has a fixed military presence in 7 of Liberia's 15 counties, and 4 of these have no presence of UNMIL armed security response capacity. As increased funding is found to respond to EVD, it will be important that the government take full responsibility for resourcing the LNP adequately and holding them accountable for delivery. Critical to this will be the ability to use this opportunity to deploy police officers more widely throughout the country. The Ebola outbreak has halted UNMIL's joint border operations with UNOSI and Ivorian authorities. Other than incidents within Côte d'Ivoire near the Liberian border in February and May, the border areas have been peaceful during 2014. Although Ivorian refugee returns remain suspended, the situation in the refugee camps remains calm. Madam President, early on in this crisis, the government established a national task force on Ebola, chaired by the President herself, operating as overall leadership for the response in Liberia. This structure, which has undergone adjustments, was criticized for failing to bring the epidemic under control. There have been calls in Liberia for a stronger international role in coordination structures. As in Guinea and Sierra Leone, discussions are underway to design an overarching coordination platform for response efforts in Liberia through a national and international partnership. Beyond an initial $20 million of government funding approved by the legislature, of which $5 million has been made available, the related trust fund has not received significant financial support. Transparent and credible financial management will be essential, and the World Bank is working on a modality through its Development Trust Fund. Since late July, UNMIL has turned its full focus to EVD and engaged in supporting the nationally led response. Given reduced activity of the government and other national actors, some of UNMIL's work as originally conceived has slowed in the areas of constitutional reform, national reconciliation, land reform, capacity building of security agencies, and natural resource management. UNMIL has not ceased its mandated activities, however, and other work has intensified in respect of the security sector and the rule of law, political good offices, protection of civilians, and human rights monitoring and support. In the fight against EVD, the mission is working through 4 pillars of engagement and support: security and the rule of law, logistics, communications and outreach, and coordination at both central and county level. Our military and police continue to provide operational advice and support to national counterparts, including embedding liaison officers within the Joint Command Center with Liberian military, police, and immigration personnel. UNMIL has worked closely with the Ministry of Justice and the Judiciary to address the extremely high rates of pre-trial detention, helping to alleviate some overcrowding in Liberia's major prisons, which is an added concern within the Ebola context. The mission is not directly enforcing the quarantining of communities or counties, but is monitoring all security operations under the state of emergency. UNMIL's own security posture is kept under constant review to best place the mission in its protection of civilians mandate. We have played a large role in the logistics of the EVD response, both in planning and delivery of operations. UNMIL leads an interagency crisis logistics team comprising WHO, WFP, UNICEF, and ICRC, which conducts logistics planning, inventory management, stock control, distribution, and coordination at the Ministry of Health and Social Welfare. This team links closely with UNMIL Logistics to deliver supplies throughout the country. In support of government outreach efforts, UNMIL has engaged in nationwide communications on EVD education and prevention measures. This is done through traditional communicators, UNMIL radio programming in 17 Liberian languages, and the printing of over 150,000 flyers, among other things. UNMIL retains a civilian presence in each of Liberia's 15 counties, where we have always worked closely with local authorities. Since March, when Lofa County became the epicenter of the outbreak in Liberia, UNMIL has provided coordination support to county superintendents, county health teams, and county EVD task forces. In discussion with several superintendents and county health teams, I have found insightful thinking, planning, and initiatives around the basic measures of preventing the spread of Ebola. So far, however, many superintendents have received only $2,300 from the central government. We understand that more funding may be on the way. Meanwhile, UNMIL has turned its ever-useful Quick Impact Projects program towards rapid Ebola support. UNMIL and the UN country team partners continue to benefit from a close and consultative relationship. 5 weeks ago, I began bringing together a few leaders of international health partner agencies on the front lines, including MSF and CDC, with a small number of UN colleagues, including the WHO leadership, to brainstorm around Ebola responses on a scale not foreseen by any existing protocols. Responding in this context is beyond any of us acting alone, and we will do everything we can to maintain these close links on the ground. In this connection, let me mention that in addition to reorienting our activities, UNMIL and the UN more broadly have advocated at the highest levels to avoid the international isolation of Liberia and its neighbors affected by the Ebola epidemic. The mission is also seeking support arrangements for frontline international responders and the diplomatic community to enable them to stay and operate in Liberia. This includes access to UNMIL's shuttle flights between Monrovia and Accra, which were reactivated on September 7th, and access to UNMIL's medical facilities for routine medical care. UN headquarters continues to engage with member states to secure an EVD-specific treatment center and medevac arrangements for UN personnel, the diplomatic community, and frontline international EVD responders. From our own organization, we seek a decision to provide danger pay to our personnel in recognition of the severe stress and uncertainty of this unprecedented situation, which is understandably not captured within the UN's existing regulations. Madam President, this epidemic of unprecedented scale would challenge any government and any society. Even as Liberia and its partners respond, the disaster continues to grow, a tragedy for a country that has seen so much hardship. UNMIL has pledged to provide its full support and continues to review the range of capabilities we can bring to ending this latter-day plague, which must be stopped in its tracks and stopped soon. Thank you.
I thank Ms. Landgren for her briefing and particularly for tailoring